is a triangle across copies by 4 years. So
So, shall we start? Hello?
Hello.
Yes, sir. Shall we start?
Yes, yes, I'm fine. How many participants are there?
We've got 53 participants.
I guess we've crossed 50. We can start. My screen is not visible. Yeah. Okay. Now it is.
Yeah. Yes. Okay. Riturima, please go ahead and start the session.
Okay, thank you, ma'am. A very good morning, everyone. This is Riturima Baidya, Organizing Chairperson of ICON 2021. Our event for today is Training in Advanced Suture.
Riturima, you're not audible. Hello. Hello, Riturima, are you there?
Yes, ma'am. I think due to some technical issues, I got signed out. Yes, sir. Ma'am, so am I audible and visible now?
Yes, yes, you are. You can go ahead now.
Hello? Okay, okay. Thank you, ma'am. A very good morning, everyone. I am Riturima Baidya, Organizing Chairperson of ICON 2021. Our event for today's morning is Training in Advanced Suture Skills, an international level suturing workshop brought to you by Clinicis Essen along with his promotional partners. We have with us today Dr. Krunal Soni sir, Shivangi Gulab ma'am, and Dr. Tanya ma'am. Clinicis Essen is a global fraternity for medical, dental, and physiotherapy students and doctors with branches in 10 countries. Clinicis M aims to elevate our fellow peers by providing plethora of learning and experiencing opportunities. Before we begin, a small introduction for today's workshop. As we all know, suturing lies in the heart of surgery. The result of any surgery is as much linked to the suturing as it is to the actual surgical procedure. And hence, as future surgeons, it's absolutely necessary that we master the skills, and who better to teach us than Dr. Krunal sir himself. And now, with my utmost privilege, I would like to introduce our esteemed guest today, Dr. Krunal sir. Sir has completed his PhD in orthopedics from Ninewells Hospital, UK. He is a gold medalist from Saurashtra University and Indian Medical Association. Currently, Sir is the assistant professor in the Department of Orthopedics in BJ Medical College, Ahmedabad. He has 6 publications in his name and has conducted several workshops. Finally, before we begin, a few housekeeping rules that we all should keep in mind. I request all the participants to keep their mics turned off and their cameras turned on during the entire event. If you have any doubts or queries, please feel free to put that in the chat box and we will address them in the right time. Finally, please maintain decorum and let's have a productive session ahead. Now I request Sir to kindly take over from here so that we can begin today's workshop. Thank you. Sir, I guess you are muted.
Okay. Hello, can you hear me?
Yes, sir.
Yes. Thank you, Riturima. Appreciate for all the kind words which you have used. Really appreciate. I welcome all of you guys for the second session. So yesterday we equipped you with the thorough knowledge of how to be in the OT, how to have etiquettes, what to do, what not to do, more importantly. Today we will equip you with some suturing skills that if you have opportunity to get scrubbed, or if you are in a trauma center, or if you're in peripheral center, and you get an opportunity to suture. So you should know at least 7 or 8 commonly used suturing skills. We had done a basic workshop, I guess 2 months back. In that, we thought about how to handle your instruments, how to hold them, how to take a proper bite. So all those basics were covered. We had also explained few types of sutures. So we'll take it from there. A short revision of what we did last time, and we'll include few more suturing techniques today. I'll demonstrate you how to do a 1-hand knot and a 2-hand knot using hands and not instrument ties. And there are some limitations because it's a home-based workshop. I cannot demonstrate everything to you. I've made a makeshift arrangement on my table. And what I'm expecting from all of you guys is, I guess Shivani might have dropped you a message that you'll need a thick towel on your table, a needle holder, and any suture material, whatever is available to you. And at the end of the session, I'll just briefly tell you how to do a hand tying knots. So for that, I'll require all of you guys to have a lace. If you have 2 colored lace, that would be better, so that you'll come to know that which lace is going where. If not, that is okay. But at the end of the session, I'll give you enough time to move around and grab one of your laces at home. The shoelace, any lace is fine. Shoelace is most common. You'll be able to get it. So with this small introduction, we'll start with today's session. Luckily, I don't have anything on the presentation except for the slide, which is visible to you. And only one thing is said to a surgeon, that you should always tie your knots properly. Let that knots be anywhere. And as you can see in this humorous picture, that this surgeon, he was a good surgeon, but he failed to tie a good knot on himself, and that's the end result. So make sure your knots are tied securely and properly, and always it is a surgical knot. It is never a reef knot. It is a surgical knot which you should be aiming at. With this introduction, I'll focus now my camera on the workstation which I have created for you guys, and we'll take it from there. Yeah. Riturima, just focus my second this thing. Now you can stop this screen sharing.
Okay.
Yeah. So,
Yeah.
okay, my table is visible to all of you guys, right? Just shout aloud, yes.
Actually, it's not. Could you please
It's not
switch?
visible.
Yes. Now it's visible.
Visible.
Yeah, it's
Visible to everyone.
Yeah.
It's visible, sir.
Clearly.
Yes, sir.
There's no glare or anything, right?
Yeah.
No, sir. It's visible properly.
Okay,
Thank
so
you.
I'll give you a few seconds time for your arrangements. Make sure that you have a folded towel on your desk, and that towel should be doubly folded. The way I've done it is like, I'll just show it to how I've done it. This is a simple towel. Okay. So what I have done is I have doubly folded on one side, and I have doubly folded on the other side to make it look like an incision. Can you see this? So I'll give you some few seconds to make this preparation on your own. Everyone is okay with it? Is everyone okay with their preparation? Can we start?
Yes, sir.
Come on, guys. 50
Yes,
of you
sir.
are there. 59.
Yes, sir.
Okay. So I have a needle holder in my hand. Just a quick revision for what last time I had taught you. I don't know if you were the same guys who attended the basic workshop or not. So in that, we had stressed the importance of keeping the needle, as you can see, oblique in your needle holder and not straight. ergonomically, if you keep your needle oblique, just like what I've done, it makes your life a bit easier to pull on the sutures. Then your thumb in the ring and your index. I usually use a middle finger, but you can also use a ring finger, whatever is as per your convenience, to take bites. And the movement should always be pronation and supination. Pronation and supination. That is the movement you are looking for while you are suturing. Okay, so we'll start with the very basic, simple interrupted sutures. Now, always try not to hold your needle with your bare hands, because you might injure yourself, and you do not want all those post-exposure prophylaxis, right? So needle always on the needle holder. Use forceps or adsense for tissues. A thumb rule, always make sure that you do this. You start following this initially, and it will become a practice for you guys. So this is one of my skin margins. This is the other skin margins. As we had discussed last time, always make sure that you take entry perpendicular. Guys, you can just start doing it along with me, and if you get stuck, tell me, I'll repeat it n number of times. Okay, so this is a basic, very commonly used simple interrupted sutures, skin sutures. So hold your skin with the help of adsense or forceps. Take a bite. Now this, if you're taking a simple interrupted suture in a very simple lacerated wound, you can take a bite from at least 2 to 5 mm away from the skin margin. Don't try to go much far beyond 5 mm. Otherwise you'll see that your edges are inverted. And in any wound to heal well, your edges should be approximated, or they should be slightly everted, never ever inverted. If you have inverted margins, you'll see that your wound is taking a lot of time to heal, because there is no approximation. So skin takes a lot of time for epithelialization. Yeah. So we have taken one bite from one of the margins. Try to be equidistant from the other end. So if you have taken, like, say, around 5 mm from one margin, try to take 5 mm from the same other margin, so that your wound is equidistant at both ends and you have good approximated margins. So this is my short end. This is my long end. And we, as surgeons, will always go ahead with surgeon's knot. So imagine a circle between these two. Look, this is my short end, this is my long end, and you imagine a circle between these two. Now you want to put a knot to it, and this is an instrumented knot. You're not doing a freehand knot. So my first loop and first second, always try to pull the suture short end away from where it is. So my short end was on that side, I'm trying to pull it towards this side. Then the second knot is a locking knot. So you have taken a knot, but this knot is not secure. This is not a locked knot. Now to make it a locking knot, you put the second bite in a reverse circle fashion. Catch hold of your short end and pull it in the opposite. You see this? This is a beautiful knot which is seen. And as you pull your short end, this knot will get locked, and now it is a secure knot. This is called as a surgeon's knot. And to secure it better, we always say that if you're a surgeon, you'll always put 3 knots. So a simple third knot over it, and this is a good knot or good suture which you have placed in. Is everyone okay with this?
Sir, could you repeat it?
Okay, fine. So this is a simple interrupted suture. We take it for a simple wound in which there is like a skin laceration. And this is my needle holder, if you can see. Yeah. Always try to put your needle and the needle holder in an angle. Okay, some of you guys want me to go slow. Okay, that point is noted, Jatin. I'll go slow. We'll start it from scratch again. Basics. This is your needle, and this is only for demonstration that I'm touching the needle. Never ever touch your needle with your bare hands or gloves. Always needle holder for needle, tissue, forceps for tissue. This is a basic rule in surgery. So make sure that your needle is not perpendicular or right angle, but it is at a oblique angle. The difference it makes is, if you see, if I'm keeping my needle at right angles, and if I take a bite, and your bite should always be perpendicular to the skin. Now, if my needle is at right angle and if I'm trying to take a bite perpendicular, I'm seeing that I have to do a lot of pronation to take that bite. But in contrary, if I place my needle at an angle, as I'm showing it to you, and then if I try to take a bite, life becomes a bit easy and ergonomic for me to take a bite. And if there's a long suture line and I need to put on some 20 sutures, it cumulatively becomes easy for me to suture. So with that principle, needle at an angle, enter perpendicular to the skin. And since it is a simple interrupted suture, you want to take the bite of full thickness or full dermis. So we have taken full thickness on one of the skin margins. Now, for you to have a good suture, good looking suture, what I mean to say is the distance between your bite and the skin margin on one side should be almost equidistant to the bite and skin margin on the other side. If you do that, if you try to do that, your skin sutures will look really pretty and cosmetic. And they will heal well because the approximation will be good. So I have taken first bite. I'm trying to be equidistant at the other side. Principle remains the same. You enter the skin perpendicular to the needle. Pull it. Now make sure that once you have taken both bites of the skin margin, you place this needle on the table so that you don't injure yourself and you don't prick yourself. Okay. Now this is my short end. This is my long needle end. What you try to do is you imagine a circle between these two.
In the morning before any meal, repeat testing of sample increases the chance of.
Who's that? Does someone have a doubt?
No, sir, you can continue. It's okay.
Okay. So this is my short end. This is my long end or the needle end. You try to imagine there is a circle between these two. And always in surgery, you want to do a surgeon's knot, not a reef knot. Surgeon's knot is nothing but a locking secure knot. So imagine a circle. The first two throws will be in clockwise direction or the circular direction. This is my circle, right? Imagine a circle. So 1 and 2, loop around, catch hold your short end, and always try to bring your short end in the opposite direction where it is, right? So we are targeting now. We have placed a knot here, but as you can see, if I try to open up my skin, this will open up because this is not a secure knot. So we want the knot to be secured so that it does not open up. So what you do is the second, again, we have imagined a circle between, this is my short end, this is my long end, and we imagine a circle. Now to make this knot a secure one or to lock this knot, we go in the opposite direction or counterclockwise to take a loop, catch hold of our short end and pull it to opposite direction. You can see this is a beautiful knot which is in place. And once you pull your short end, this will get secured and it will get absolutely locked. Again, since we are surgeons, we want to make sure that we are extra careful, and always surgeons means 3 knots. So I'll put one more loop, catch hold my short end and bring it to the opposite direction to just reinforce whatever knot I've done. Is this absolutely okay and comfortable for all of you guys? Especially for the one who requested me to repeat, are you okay with it or you want me to show it again? Answers, guys.
So do you mind showing the knot again? I'm so sorry.
Okay. Yes, absolutely. No, don't be sorry. See, till the time each one of 60 of you are very comfortable and confident in doing it by yourself, I will repeat it. I'll keep on repeating it. Okay, because this is very important. So we'll take one more. The screen is visible. I'll take it a bit this side so that it is visible. So principle remains the same. Keep your needle holder at an angle to the needle. When you're taking entry, the entry should be absolutely perpendicular to the skin. Pull it from the skin margin. Catch hold your needle holder again. Make sure that you are equidistant when you're coming out. Pull it out. Make sure you park your needle on the table somewhere away, but on a sterile area, of course. And imagine this is my short end, this is my needle end or the long end. Imagine a circle running around between these two ends. The very first two are clockwise loops, which you take on the long end, catch hold the shorter end, and always bring on the opposite direction wherever it is. So my short end was on this direction. I am pulling it on the opposite direction. So you see this, the knot is now visible to you. You can see two good loops which I've made and the knot is visible. Now you tighten this. But still, this knot is not yet secure, or what you can say, this knot is not locked yet. So we want to lock this knot. To lock this knot, again, this is my short end. This is my long end. You imagine a circle running around between these two. And now take a loop in the counterclockwise direction. Catch hold the short end and pull it. You can see this loop which is forming over this. And now as you pull the short end away from the initial direction it was, this will get secured, locked in its place. Surgeons means 3 knots. So I'll just take one more knot for safety, security, put it on place. And this is a good knot, good suture which you have taken. Everyone okay with this?
Yes, sir. Thank you so much.
Yes, sir.
Good. Now I am hearing some voices. Everyone woke up now or what? Or they've not yet had your coffee or tea? Good morning, guys. Good morning.
Good morning, sir.
Good morning,
Good morning, sir.
My God.
Good morning,
No
sir.
reply. Come on. Good morning, every one of you. Where
Good
are you
morning,
lost?
sir. Good morning, sir.
Morning, sir.
Good morning.
Thank
Morning,
God.
sir.
Morning, sir.
Morning, sir.
Morning. Okay. Finally, yeah. Finally. Great. I should have done that 10 minutes back, I guess. Okay. So we have done with a simple interrupted suture. A few things to remind. It is a full thickness or full depth of dermis we take around from the skin margin. If this is my skin margin, we try to take around 5 mm from the skin margin, both ends. So this is my skin margin. I'll take a bite 5 mm from here and 5 mm from here. Some people will have doubts that how many knots to place. So it depends on your length of the suture, and approximate rough idea, you can say that the distance between 2 knots should be around 5 mm. So you can have a 5 and 5 rule that you take a bite 5 mm from the skin margins, and the distance between 2 knots should be around 5 mm. If you take very close, it will get tedious for you to take multiple bites. And if you take very far, your skin might not heal. So remember a rough 5 mm or 0.5 centimeter rule, that 0.5 centimeter from the skin margin, 0.5 centimeter from each other. That way you can remember it. And since this is not a real skin, what I'll try to tell you is, you try to take a bite. Suppose this is my palm. Okay, everyone can see. So this is my skin, and if I got a laceration on this ulnar aspect of my hand, and if you're trying to take suture, you will see that my ulnar aspect will be a bit mobile. This aspect, if I have a laceration here, this side will be a bit mobile, and this side will be a fixed one. So whenever you try to take a simple interrupted suture, make sure you start from the mobile end and go towards fixed end. That way you'll get a better approximation. Am I clear, or do I need to repeat it again?
Understood, sir.
Understood?
Sir,
Okay.
could you repeat again?
Yes. So suppose I have a laceration on my hand, and it is on my ulnar wards, on my 5th finger. Okay. So you will see that when there is laceration here, since my rest of the hand is still attached to the wound, this side of the incision or this side of the laceration would be fixed, but this side of the skin would be a bit mobile, or it will be free one. Okay, so whenever you're trying to take a simple interrupted suture, you start your bite from this end and go towards this end, so that you're trying to approximate the mobile edge towards the fixed edge to get a good approximation of your wound. So remember the principle, and you can apply it when you're doing it. You are supposed to go from the mobile end towards the fixed end. So wherever in the body you have a suture, a laceration, go from the free or the mobile end towards the fixed end. For example, here the free end would obviously be the skin which is lax in the inner aspect of the skin. Got it?
Yes, sir.
Good, fine.
Yes,
So
sir.
as I have said that the distance should be around 2 to 5 mm. If you try to go more further, say around you're taking the bite 1 centimeter from the skin margin, you'll see that your skin margins will get inverted. And never ever you should have inverted skin margins. I would not say never, because you should never say never, but still your wounds will take a lot of time to heal. The approximate time healing of wound is around 10 to 12 days. But if your margins are inverted, so this is called approximation of margin. This is called eversion of margin. And if your margins are inverted like this, they'll take a lot of time for epithelialization. You might end up spending 4 weeks dressing that wound because the edges are inverted. And the most common mistake what surgeons do, which leads to inversion of the margin, is they take the bite quite away from the skin margins. So 5 mm is the standard distance. You will see that the plastic surgeons which tend to go for a cosmetic wound, they'll take the bite very close to the skin. So as you come closer to the skin, you will see that your scar is very thin and it is very cosmetic, but you'll need to have good suturing skills for your wound to get approximated. So I would not say that initially you target very close to the skin margin. You keep a target of 5 mm initially, and then as you progress, you come closer to the skin margin as you get confident. Okay, so now we'll go ahead with the second knot. The second knot which I'm trying to show you is a simple buried knot. Now we have seen a simple interrupted knot which we most commonly use for skin. Next is a simple buried knot. Now buried knot which you take is for deeper tissues. Suppose if you have a full thickness laceration of the skin, the subcutaneous tissue and also the fascia is exposed. Suppose your skin laceration looks something like this. It's a deep one. It's the depth is through and through till you can see the fascia. So what you do initially is you'll take a buried knot for your fascia and for your subcutaneous tissue. Bury means actually your knot will get buried, and then on top of that you'll take a simple interrupted suture. So I'll just demonstrate to you how do you take a simple buried knot. I hope everyone is ready with their holders and their needles. So there are two ways in which you can take a buried knot or simple buried knot. What you can do is you can start from near margin towards you. This is my near margin. This is my far margin of skin. Okay. So what you can do is as you can see, I have reversed the way I'm holding the needle holder. So the simple buried suture starts with you go superficial and then you come out deep.
There's only one little strong.
Sorry, come again.
Oh yeah, two. One this and one. I should have put small instead of medium.
Someone has a doubt? Go superficial. If you are taking.
Sir, could you show that once again, please?
Okay, fine. I'll repeat it again. Fine. So first we have done with the simple interrupted suture, which is most commonly for your skin surface. Suppose if you have a laceration which is deep enough, that means that your skin is gone, your subcutaneous is gone, your deep fascia is also exposed. Now you have a full thickness. This is called as a full thickness wound. And if you have a full thickness wound, if you just simply close on the superficial skin, you'll have a lot of dead space in your wound. And whenever there is a dead space in the wound, that leads to a collection and it is a prerequisite for infection. So you don't want any dead space in your wound. So what you do is if you have a deep laceration or a deep wound, you initially close the deeper layers and then come on your skin. So to close the deeper layers, there is something called as a simple buried knot. Okay, now I'll tell you how to take a simple buried knot. As you can see, I have holded my needle in a different way. Usually you hold your needle like this, right? But I'm taking it in the opposite direction because right now, this is my close margin. This is the away margin. This is a near, this is a far one. Okay, and you want this not to be buried in the skin. So we'll start from the far and then I'll show you how to take it from the near. So this is my skin. I'm not taking this on a skin. I'm taking on the deeper tissues. So what I'll do is I'll try to evert my skin, go deep through the fascia and the subcutaneous tissue, come superficial. So I'm taking entry deep, but I'm coming out. Mark you, I'm not coming through the skin, as you can see. I'm not trying to come through the skin, but I'm just trying to come just subdermal to the skin. So I've gone deep, come out superficial. Now, is everyone following me?
Yes, sir.
Yes,
Okay.
sir.
Yes, sir.
Yes.
So every one of you has taken a bite which you've gone deep and come out superficial, yeah?
Yes, sir.
Okay, now reverse your needle. Place your needle like this. I'm sorry, but I need to demonstrate to you. That's the reason I'm touching it. This is only for demonstration. Keep your needle like this. Hold your needle holder. And now you're going to go superficial and come out deep. Is this visible and okay to all of you guys? And now, what one thing which you need to remember is where your short end is, your other end should come on the same direction or the same side. It should not happen that your short end is here and you're coming out from the opposite direction. So your short end and your needle end should be parked on the same side. And now the same principle again. For 1, 2 in circular motion, catch hold your short end and bring it in the opposite direction, and you will see that your knot is absolutely buried and not visible at all on the skin. Can everyone appreciate? Again, now we want to lock it. So 1 counterclockwise, catch hold your short end and just pull it. Your knot is absolutely buried under your skin, not visible on the tissue at all. And to secure it, 3rd knot, and your knot goes very deep inside the tissue, not visible on the surface. And that is our target, and that's why it is called as a simple buried knot. Can anyone see my knot? Is this okay?
Yes, sir.
Is everyone got a good deep buried knot on their towels? Every one of you guys?
Yes, sir.
Yes, sir.
Good, fine. See, I guess we'll do one thing, Riturima.
Yes, sir.
Like yesterday, we had a surprise gift for the ones who had done well in their quiz. We'll do one thing. The ones who send the photographs of their suture towels, we'll have a look at it, and the very beautifully, nicely done one gets a reward at the end of it. Yeah, we'll do that.
Yeah, great. Yes, sir.
So all of you guys, make sure that you do it nicely. The one who gets perfectly and beautiful looking knots, all of them get a prize. Okay. Can I go ahead?
Yes, sir.
Okay. So this is a simple buried suture. It is also called as deep dermal suture. And as I have explained before, it is for your deeper tissues so that there is no dead space and you are able to comfortably suture your skin. Okay. Make sure that there is no tension when you are doing this. So if you take the bite the way I've shown you, you go deep to superficial and then superficial to deep. So you have started deep and you have ended deep. So your knot will be buried. Is this concept clear?
Yes, sir.
Yes, sir.
Okay. So now we'll go to something which is called as a vertical mattress suture. It is also called as a far, near suture. Okay. This is a very, very common suture which is used and on areas where it is difficult for you to approximate the skin neatly, you'll use something called as a vertical mattress suture. Okay. And for example, there is an injury on the forearm and your tissues have been swollen up very nice and hard. So whenever there is a swelling or whenever there is a tension in the wound, or for example, there's a wound on the scalp, which is a bit difficult to suture. So in that cases, you will need something called as a vertical mattress suture for a better approximation of wounds, which are difficult to approximate. Okay, so we'll start with something called as a vertical mattress suture. In vertical mattress suture, sorry guys. Is my camera visible? Yeah. So it is called as a deep, shallow suture also. And it is also called as a far, near suture. Why it is called so, I'll just try to explain it to you. So again, principle remains the same. My needle is at an angle to the needle holder. The entry which I'll be taking is perpendicular. But since this is a vertical mattress suture, also called as a far, near suture, generally what distance we take from the skin to skin margin is around 5 mm. In vertical mattress sutures, we'll try to go around 7 mm from the skin margin initially. So my initial bite would be around 7 mm from the skin. It will be a full thickness, deep bite, which I'll be taking. I'll take the bite, come out from the margin, make sure that the end is adequately short enough so that I don't waste a lot of my suture. I'll catch hold of the second margin. And we have taken 7 mm from the skin of one side. We'll try to replicate the same full thickness 7 mm on the other side. I'll park my needle away from me. So this is the first half of my vertical mattress. Skin margin 7 mm from one side, skin margin 7 mm from the other side, full thickness bite, full thickness bite. Now, the second half of the suture, I'll reverse my needle as I'm showing it to you guys. I have reversed my needle and now I'll become close to the skin margin. So first is 7 mm. Now this will be around say 3 mm from the skin margin. And this will be a shallow one. Shallow meaning you are not going to take a full thickness bite of the dermis. You'll just take a subcuticular one. So shallow on the other end, come out. Pull it, park your needle away from you. The principle remains now the same. This is my short end. Imagine a circle running around. 1 throw, 2 throw, catch hold your short end and pull it. You can see my knot. This is a good, nice, beautiful knot. I don't know if it's very much visible to you or not. But if you look into your own knots, you try to pull your short and long end. Do not try to squeeze it right now. And you can see there is a beautiful lace like 2 knots which will be sitting. Try to pull it apart. And now you can see that the skin which was far away, we imagine that there is some wound gaping or there is some swelling. And the skin is come very close to each other and it is borderline everted also. So this is what the beauty of a vertical mattress suture is. It's a very powerful suture, if I can say, right? Second, reverse, catch hold your short end. You see this nice, beautiful sitting knot, which you will see, and pull it in the opposite direction and secure and lock your suture. For additional safety, a third one.
Sir, can you please repeat it?
Is everyone okay with this?
So could you demonstrate it again?
Okay, no issues. So I'll demonstrate somewhere close to you so that you are able to see. This is a vertical mattress suture. It is also called as a deep, shallow suture, also called as a far, near suture. So, and you take this in cases where there is a lot of swelling, lot of tension is there in the wound. The edges are not approximated, but there is slight gaping seen, just as I've shown it, I've demonstrated in my fingers, that there is slight gaping of wound. Or the wound is in areas like scalp, where you get a lot of tension beneath your wound because of the bone. So you'll catch hold your skin on one end. Usually we take around 5 mm from the skin margin. In vertical mattress sutures, your initial bite which you'll be taking is around say 7 mm from the skin margin. You'll take a 7 mm bite. You'll come out of the wound. And this bite would be a deeper bite. Deeper meaning you'll take full thickness bite of a dermis. You'll come out 7 mm from the opposite direction, again going deep so that you take a good full thickness bite. You'll pull out your needle again. And now you have to take bite shallow, or near. This was my far. This was far. I'll reverse my needle edge. I want to go in again. I'll catch hold my skin margin. I'll take a bite which is close, say around 3 mm from the skin margin, come out through the wound. Again, go in from the opposite direction. Try to be equidistant at all the times for you to have a cosmetic wound. Pull your needle from the opposite side. Park your needle away from you. Surgeon's knot. This, imagine a circle again. This is my short end. 1 circle, 2 circles. And pull it in opposite direction. And now you can see that the skin is actually trying to come close to each other, and there is borderline eversion, which you'll see on your tables as well. Again, reverse, catch hold your short end and pull it in opposite direction. Third, always 3 knots, pull it in opposite direction. Cut it. Yes. Is it okay?
Yes, sir.
Good. So this is a very powerful suture which you have in your practice, and wherever you see that there is some gaping or the skin margins won't approximate well with a simple suture, you can always take a vertical mattress suture. It's a very powerful suture. As you can see, even on your tables, it will cause eversion of the skin, and eversion is always better. It is always better. It gives good results. It causes good healing of your skin. Okay, can we go ahead? Can we go ahead, guys?
Yes, sir.
Yes, sir.
Yeah.
Okay, so now the next suture which we'll be taking is a horizontal suture, mattress suture, also called as a box suture. Now, I'll explain it to how do you take it, and then I'll tell you if it is very much useful in your practice or not. So what we have done is we have taken a vertical mattress suture. Now we'll try to take a horizontal mattress suture. So again, principles remains the same. Needle at an angle, entry perpendicular, come out from the wound, go back in, try to be equidistant around 5 mm from the skin margin, not very far like mattress suture. Bring your needle from one end. Okay. Now again, reverse your needle. But in mattress suture, we went in line of the initial bite. But in box suture or horizontal mattress suture, we'll try to take an entry 5 mm from the original one, come out through the wound, go back again, and come out from the opposite margin. Try to be at the same distance as you took before. Pull your needle out. And this is my small end. This is my long needle end. 1 throw, 2 throws. Pull your needle and opposite side. Again, as a surgeon, 3 knots. I'm sure falling short of my suture, but yeah, successful. Okay. So this is called as a horizontal mattress suture. So this is nothing but an extended version of a simple interrupted suture. You take a simple interrupted suture, but you don't cut your needle. You go one step ahead, take one more simple interrupted suture, and then lock both the sutures together. So this is called as a horizontal mattress suture, or also called as a box suture. Is everyone okay with this?
So can you repeat it again?
Yes,
Can you
I can,
repeat
for
it?
sure. Yes. Again, we'll go ahead. I'll just remove these sutures for you so that it's easier for you guys to see. Okay. But you guys don't remove the sutures, yeah? We want you guys to send us your pictures.
So in horizontal mattress, all 4 of them will be deep, right?
So this is like a simple interrupted. Yes, it's a full thickness dermis. Full thickness dermis. Yes.
Okay, sir.
Okay, so we'll go ahead and take our horizontal mattress sutures or box sutures, also called as a box suture. So this is my skin margin. I'll go 5 mm, full thickness on one side, come out through the wound, pull my other end of the margin, come out at the equidistance 5 mm, full thickness again, bring out my needle. I'll reverse my needle, hold it again, and now I'll go back in same distance 5 mm, come through the wound margin, go back again, and I will exactly be near where I've taken initial entry. This is my park the needle away from you. This is my short end. This is my long end. The principle remains the same. Imagine a circle. 1, 2. Catch hold the small end. Pull it. Imagine a circle. This time we are going reverse. Pull it away from where it was, the short end. And third to lock it nice and good. Is this okay?
So the second suture is parallel to the first one, right?
Yes, it is parallel and it is equidistant. If you do that, your suture would look very cosmetic. If you try to be parallel, if you try to be equidistant, your wound and your suture will look good, nice, cosmetic.
Thank you, sir.
Yes, every one of you is okay with it now.
Yes, sir.
Good.
Yes, sir.
So just to revise, we've done with simple interrupted suture. We've done with a simple buried or a deep dermal suture. We have done it with a vertical mattress suture. We have done with a horizontal mattress suture. Okay. Now, this horizontal mattress suture or box suture, the only advantage which I would say is, suppose if you have wound on your palm wounds are a bit difficult to approximate. So you can use your horizontal mattress sutures here. But when studies show that in comparison with all the other sutures which we have, the box suture or the horizontal mattress suture, they cause hypoxia of the tissue because they are powerful sutures, more powerful than vertical mattress, and they actually squeeze your capillaries very hard. And it is seen that the tissue hypoxia with horizontal mattress suture is much more than in comparison with all the other sutures. But it saves a lot of time because you can see that instead of two sutures, two simple interrupted sutures, this is as good as one suture which covers a distance of 1 to 1.5 centimeter of your wound. So if you have a very long wound and you want to save some time and you want a good, solid, airtight closure, horizontal mattress suture is your answer. Okay. Now, next we are going to something which is called as a half buried suture. As the name suggests, this is a half buried. Initially, we have seen a full buried suture or a deep dermal suture where the knot is not visible on the skin at all. Now, we'll do something called as a half buried suture. I'll tell you where exactly it is used, but I'll just demonstrate it first. So, suppose this is my wound. This is my far margin. This is my near margin. So, in half buried suture, I'll try to go full thickness on one side. So I'll take my bite, same, it will be a full thickness bite. It will be around 5 mm from the skin margin. It will come out of the skin margin. Okay. Now, as the name suggests, please do not try to hold the needle the way I'm holding it. It's just for demonstration and I don't have any help. So I have to do it. Okay. Now, when you come on the opposite side, you do not go through the skin, but you go subcuticular. Subcuticular means below the skin. So you come full thickness on one side, you will go horizontal below the skin and you will remain below the skin. You will never come out of the skin. As you can see, this is my skin, but I'm gone subcuticular on one side, not come out through skin at all. You'll catch hold your needle and you'll go back again on the far. Equidistance, parallel, come out. And same principles. 1, 2, catch hold the small end, opposite side, lock it. So you can see that there is only skin margin, or my suture is there only on one end of the wound. The other end does not have a suture at all. So these sutures, which are called as a half buried sutures, we use in plastic surgeries where you want very cosmetic looking wound. You don't want holes to be on opposite side. Or for example, your suture is on area, for example, it is on face. And for like you've got a guy who has a beard on one side and on the face, you don't want your suture to be coming out from the opposite side. So what you'll do is you'll use something called as a half buried suture, where you'll go from skin to one end, but opposite side, there won't be anything coming out of the skin. It will be a subcuticular. So it is a half buried suture. It's a very beautiful suture. You can use this suture routinely as well. It takes a bit longish time for you to do it, but your wound looks very pretty and neat because you don't have any holes on one side. You just have holes on other side. Is everyone okay with this suture? This is a very nice, beautiful suture. I usually tend to use in my female patients because they don't want the scars, or they don't want holes on their skin. And this helps, this gives a very good cosmetic result. Is every one of you okay with this?
Sir, could you repeat it again?
Amruta wants me to repeat it. Okay, fine. Amruta, I'll repeat it for you. Are you guys doing it with me or what?
Yes,
Yes,
sir.
sir.
Okay. So this, for example, I have a facial wound. This is one margin of my skin, and this margin has some hairs on it, so that the wound is covered by hairs. It won't be visible. This margin is on the face area where there are no hairs. So what we'll try to do is we'll try to take bite of skin on this, and we'll go subcuticular on this. So I'm taking full thickness, 5 mm from the skin, coming through the wound. I'm now placing my needle in a horizontal way, and I won't go like this, but I will go in a horizontal fashion. As you can see, at all the times I will be beneath the skin or subcuticular, as you see. It does not come out through the skin at all. It is just below the skin in a horizontal fashion. Again, hold the needle, and this time come out from where you came, 5 mm from your initial bite, equidistance, parallel. Pull it, pull it, pull it. Short end, long end, imagine a circle. 1, 2, catch hold the small end, opposite direction. Lock your suture, nice and good. Third. You have suture at one end, holes at one end. You have nothing at other end. Beautiful, nice looking suture. Very cosmetic, very satisfying, both to the surgeon and the patient. Is every one of you okay with this?
Yes, sir.
So this can be called,
Yes, sir.
this suture, we can give a name to this.
Yes, sir.
So this is a horizontal mattress suture on one side, and this is a subcuticular suture on the other side. Okay?
Yes, sir.
Good. Now, as I've explained that on areas where you don't, first I use this suture on female patients so that the scar is not very visible and there are no holes on the skin. Second, I use on facial wounds where you want minimal things to come out. Third, where I routinely use this wound is, suppose if you have a wound which is the shape of a V. Suppose I'll demonstrate to you that. I'm just explaining. Suppose I have a wound which is the shape of V. Say something like this. I have a wound with a flap coming out. So imagine this is my skin, okay? And this is my opposite skin. So this is one V, and this is a flap which is coming out. So when you have a wound in the shape of the V, we usually take this type of suture, which is a half buried suture, so that we don't compromise the vascularity of the flap. This is a flap which is coming out, skin flap. This is no normal skin margin. And to save the vascularity of the tip so that there is no blackening, there is no necrosis, and you have maintained the vascularity of the skin, we take something called as a half buried suture. Now I'll demonstrate to you. Guys, do you have an orange in your hand, as I had requested all of you to have one?
Yes, sir.
Okay, get your orange on the table and get a scalpel. I'll get mine. Yeah. Yes, so everyone is ready? Now I guess I need to shout out by names. So Udit, Dipansha, Aditya.
We are ready, sir.
Yes, sir.
Adarsh,
Sir, we are ready. Yes, sir, we are ready.
Aryan, Asmita, Bhavna. Is everyone ready?
Yes, sir.
Yes, sir.
Definitely, sir.
Fine, good.
Yes, sir.
So take your scalpel. Put a full thickness V-shaped wound over your orange. Full thickness V-shaped. Okay, just like I've done. Try to lift, try not to damage it because it's not very sturdy tissue like skin. It's a very pliable, soft one. So try to raise your flaps well so that you are able to see when you suture. See, I've done it. I don't know if you would have an artery or not. Artery makes your life a bit easier. So you see, for example, there's a V-shaped wound on my skin. And what happens with, I'll get it a bit close to you. Okay, so this is a V-shaped wound. And what we notice and what the literature says that whenever you have a V-shaped wound, the tip of this, the V, this becomes necrosed and blackening happens because of the vascularity compromise while you are taking multiple bites. So when this is the scenario, you can use this half buried suture so that you don't compromise the capillaries and the vascularity of the tip and there is no blackening which is seen. So we have learned how to take a horizontal, a half buried suture, and we'll try it on this. Let's see how the results are. Yeah, every one of you try with me. Since it is orange, it will wobble here and there. Try to be a bit gentle. So,
Sir, can you please zoom a little bit?
that is okay. I hope that helps.
Yes,
Is
sir.
it?
Yes, sir.
Good enough?
Yes, sir.
Yeah. Okay. Fine. So I'll go from one end, as you can see. Is it visible, right? It won't be very perfect, but try to just, learn the principle. I'm coming out through the wound. Now, I do not want to compromise the skin vascularity of my tip. So nothing is going to come out through the skin. I'll just try to take a horizontal subcuticular suture through the inner margin. You'll cut through it because, there's a not very sturdy tissue. It's not skin, but I just want to explain the principle behind this so that you can practice it when it comes to real life. Okay. I don't know how successful we'll be in taking this suture, but yeah, we'll try. So I've taken the bite through my subcuticular area, not come out through the skin at all, but wow, my initial suture is going out. We'll take it again, guys. So this is my flap. I'm going in from one end, coming out. I'm taking my subcuticular one through this. It's cutting through. I'll try again. This thing won't come out as it looks here because your suture is subcuticular, but just because this is not skin, it is orange, it'll look like that. But your suture won't be visible on your normal skin, yeah? And try to come out at the same distance. So this will be all inside. 1, 2. It is cut through, but I hope I'm able to demonstrate the principle behind this. It's a very soft tissue. It does not hold it well. And I could not find an alternative for you guys to explain it to you more better than this orange. This was all what I could. I tried a lot of things, but can't find it better. So I hope all of you guys have got the principle behind this. Yeah?
Yes, sir.
Go horizontal, full thickness. Go underneath your flap. Do not try to come or damage. And whenever you're dealing with flaps in suturing, try not to use a tooth forceps like this. Try to use a simple forceps so that you don't squeeze the blood supply, which is very minimal in these flaps. And there is no tissue necrosis. So don't use a tooth forceps, use a simple forceps. Just try to minimally touch this flap. Go one bite through the subcuticular area, come out on the horizontal area, and just tie a knot. We will try one more. Let's see if it comes this time. Yeah. Are you guys trying with me? Is any one of you successful? Shout. Give a good shout if someone.
Yes, sir.
Show me the screen. Who's successful?
Oh shit.
Show me. Who said yes?
Is this all right, sir? Can
No, not visible. Riturima, who's successful? Let us all see. Who's this good, nice surgeon who's able to do it? Let us appreciate that. What's your name?
Azhar, sir.
Azhar.
Yeah.
Riturima, can you allow him to share his screen for once?
So that I think we need to talk to Shivani ma'am because she is the host.
Yeah, Shivani. Let Azhar share his screen for once.
Yeah, yes, sir. I'll put him on the spotlight. Just a second, huh?
Yes. Let us all see how beautiful Azhar has done. Yeah. Azhar, I need to learn it from you guys, man. I'm not able to do it.
Sir, I'm showing it on my video, sir.
Yeah, she'll do the needful. Shivani is doing the needful.
We can like put him
Is
on
it visible?
spotlight.
Is it visible?
I can't see.
Azhar is on the spotlight.
Yeah, it's visible, ma'am.
How do I see it?
Sir, you'll have to see it through your laptop. Can you see on your screen?
No, I've shared my screen on laptop, so that's the reason I'm not able to.
Yeah, sir. You can stop sharing the screen over there.
Okay, I shall stop it.
We also have Aditya, Chaube, and Shavir who have.
Just deny my screen sharing permission now. Once I'm not able to do it.
Sir, you'll have to stop your screen sharing.
Okay, I'll have to stop my screen sharing. It's a task for me to stop screen sharing, you know. Because I focus my camera like somewhere. Can you do it for me?
Okay, I'll see. Just a second.
Sir, I got it, sir.
Okay,
I
fine. I've stopped. Now.
Yes. Can you see the screen, sir?
I can see screen. Yes. Who has got it?
Azhar, Shavir, and Aditya Chaube.
AZ. Put them on the screen, na? The way my screen was. Let everyone have a look at them.
Yes, sir. I've spotlighted them. Everyone. All the three delegates have been in the spotlight.
Only I can't see. Huh? Rest everyone can see. My God.
You can turn on the gallery view.
Gallery view. I am a bit technologically handicapped. Yeah, I know how to perform surgeries. I don't know all this, so I'm trying.
Yes, sir. Sir.
How to do it?
In one of the corners, you will see switch to gallery view. There's switch to active speaker and
gallery
also
view.
the...
Got it.
Yeah.
Okay, Azhar. Yes. Very nice. Azhar has done. Shavir has done, and Aditya has done. Very beautiful, guys. Danush has done, I guess.
We also have Danush, sir.
Danush has done. Marvelous. Very beautiful. Very happy to see this. Very, very happy to see this. Beautiful, guys. Come on, we don't have a female surgeon. Females are supposed to be much more soft and delicate to handle these tissues. No female surgeons? The world is reversed, yeah? Guys have become soft and modest. Okay, good. Fair enough. We can switch it over again the way it was. Good, guys. Very happy to see it. Very, very happy to see it. I'll try once more, you know. I don't give up, man. My God, not possible. It's broken. Okay, good. So I'm very happy that you guys are able to do it and I'm not able to do it. That means that I'm teaching something right at least. So I am very, very happy to see this. Very good, guys. So we'll go back again. We're finished with, this is something called as a half buried suture. Also, it can be named as like horizontal suture on one side, subcuticular suture on the other side. Okay, now we'll move on. We'll go to some next, which is called as a simple running suture. So as the name suggests, it's a simple running suture. And why it is called as a running suture, I'll just tell you in a bit. So same principle. For example, this is our wound. This is the other end of the wound. And this is the first end. I'll clip it. So we have a small wound, something like this. This is our laceration or a wound. And we want to do something which is called as a simple running suture. So first thing, you make sure that you have enough of your suture for this wound. Suppose if you have this wound, I have this suture, so it is good enough. The very first thing which you need to see and make sure is you have enough suture for you to take the entire length and have a good knot tying at the end of it. Okay, so principle remains the same. We start off just like we started with the simple interrupted suture. Take the entry 5 mm from the skin. Come out through the wound.
Sir, we are not able to see it, sir.
Oh,
Can
you're
you
not
zoom
able to
out?
see. Okay, my bad, my bad. Pardon me, please. I'll just be a bit more closer. Yeah, I'll do one thing. I'll remove my other switches so that you're able to see this one.
So you could shift the towel into the camera field. The part where you're suturing.
If you're seeing on my laptop view, there's a lot of makeshift arrangement which is done, and I cannot move anything, you know. So pardon me for that. So you can see this, right? Yeah. So we'll imagine that
Yes,
this is the other end which is locked, and this is my starting end. Principle remains the same. Oblique entry. We'll take perpendicular, just like simple interrupted suture, come out through the wound, go back in and come out. Yeah. Now, just like a simple interrupted suture, we'll take a knot in this. Short end, long end, needle end, circle, 1, 2, catch hold your, and just pull it in the opposite direction. This is not secured. Reverse direction, catch hold your, and beautiful sitting, not secured and locked. One more. So now we have one of the knots which is parked in. Okay.
Sir, could you please repeat it?
You want me to repeat it? So see, this is a simple interrupted suture what I've taken. Nothing else but a simple interrupted suture, the very first one. We have not started yet the running one. Okay. Is it okay?
Yes, sir. Yes.
Okay, now we'll start with something known as running. So in simple interrupted suture, what we'll do is we'll cut this off. But in running suture, we would not cut that, and we'll continue to take sutures one after other and try to be equidistant at the same time. So suppose this is my wound, and this will approximately require, say, 4 or 5 bites. So I'll go back again around 5 mm from my initial suture, come to the wound, and pull my needle. I'll go back again. I'm not cutting my equidistance 5 mm from each other. You see, nice and beautifully your skin will approximate with each other. This is a very good time-saving, better looking or simple running suture which you can take. Go back in 5 mm from the original one, come through the skin margin, go back in again and come out. I'm not just cutting it yet. You see, nice, good looking suture which you'll get on your screens as well.
Excuse me, sir.
Yes.
Sir, the second, after the first knot, the second incision we do, should we go from the same side or the opposite side?
So I've started here. Okay.
Yes,
I came out here. I parked my knot on one side, and again I started from same. So you start and then you keep on starting at the same time on the same side. Sorry.
Okay, sir.
Okay.
Yes, sir.
So I'll take the last one, equidistance from the previous one, come out to the margin, take a bite, come through the other end, and this time I'm going to lock my suture. So this is my loop, this is my free end, and now we need to secure this suture with a knot. So 1 throw, 2 throws, catch hold your loop, and just beautiful lock it. As you can see that this is still loose because we have not put a locking knot on this. So hold one end, make sure that you are pulling both the ends of the loop, just like I'm doing it, so that your skin is approximate nicely. Reverse direction, catch hold your loop, pull apart, and make sure that you are pulling both the ends of the loop, both the ends. And now this is a locked one. Just to add security, a third one, make sure you are pulling both the ends of the loop. When you pull both the ends, your knot will go nice, sit beautifully on the skin, and cut it. Is everyone okay with this?
So could you give us a minute just to
Yeah,
suture it?
absolutely. Take a minute. Take a minute. Just practice it. Any one of you guys want me to repeat it? Just shout it. I'll do it for you.
Sir, could
Can you
you
repeat the
Yeah,
the
yeah.
last knot again?
You want me to show? I'll repeat the entire thing for you. Okay. Give me a minute, guys. I'll just cut it. Okay. So, for example, this is the start of my wound. Everyone can see. This is the end of my wound. I'll just place a scalpel here so that you will come to know. This is my end. This is my start, and this is my incision. Okay. So we'll start in a fashion which is simple wound, simple interrupted sutures. I'll go 5 mm from the skin margin, come out through it, same distance, park your needle away from you, but in a sterile zone. Catch hold your short end. 1, 2, catch hold your short end, pull it apart, lock it with a surgeon's knot. Okay, so now in this, since my short end is a bit longish, I'll just cut it a bit. Okay, so this is a simple running suture. In a simple running suture, we are not cutting both the edges of the suture. We'll continue taking sutures. And this is especially helpful when you are a single person and you don't have any help to cut your sutures. So go back again, be 5 mm from the previous one. Rest of the principles are all the same. Just make sure that you are around 3 to 5 mm from each other. Yeah. 5 mm from my previous one, go in, come out. Again 5 mm, equidistant from each other and equidistant from the previous bite. And suppose this is the end of it. So I'll take one more throw and then I'll lock this suture. Okay. So again 5 mm, equidistant from each other. And now you'll see that this is my loop. I'm not pulling it completely. This is my loop. This is my needle end. This is my needle end. This is my loop. So to lock it, what I'm going to do is pull it adequately enough. So imagine circle again. 1 throw, 2 throws, catch hold the loop at the top, pull the loop. Once you have done this, then make sure that you individually pull both the ends of the loop, both ends. But you'll still see that this knot is not secure. So reverse, catch hold the loop again and pull your suture. And again, you are making sure that both the limbs of the loop, you have pulled it good for you to secure it. And now you are seeing that this knot is secured. A third one, and this is a good suture. Are you guys okay with this now? Hello, are you guys okay?
So can you give
Yes,
us
sir.
the
Yes,
Every
sir.
one of you has got this right on their boards. Simple running suture. So this simple running suture, you can take it on skin. You can take in your subcuticular area. You can take this in subcutaneous tissue, and you can also take this closing the fascia. Everything you can use. This is a universal type of suture which will save some of your time, and you can do it without the help of the is everyone able to hear me? My one of the screen is got off because of low battery. I'll just switch it on. Shivani? Shivani?
Yes, sir.
Yeah, just give me a minute, guys. One of my laptop screen has got off because battery was low. But you are able to hear me, right?
Yes, sir. We can hear you. We can see the workspace as well. No worries. Please
Correct.
take your time.
Correct. So every one of you guys have got this correctly. The simple running suture, which can be used anywhere. It's a universal type of suture. You can use it anywhere and everywhere. You can use it on skin. You can use it on subcutaneous fat. You can use it even closing fascia.
Hello, sir.
Yes, tell me.
Sir, how tight must the suture be exactly, sir?
Your skins should be approximated, or they should be everted. That is the end point which you're looking for all the sutures whenever you take. Your skin should be approximated like this, or it should be slightly everted. Eversion helps in wound healing. So that should be your target. Whenever you see inversion of the skin, make sure you cut out that suture and resuture it.
Sir,
Okay. Yes. I guess this thing is again visible, right? Hello?
Yes, sir.
Yes, everyone can see my station and listen to me, right?
Sir, there are some voice glitches. Do you sign in from the second device also?
Yeah.
Yes, sir. Please mute your other device.
I have muted my other device. Okay.
Also, disconnect the audio. So, disconnect the audio on your second device.
Is it fine?
Yes.
Yes, sir. It is fine.
Okay, fine. So everyone has got a simple running suture on their boards, right?
Yes, sir.
Good. Now, the second variant of this running suture is called as a simple locking suture. So in this suture, we kept on taking bites, but we didn't lock while suturing it. So now next will be a simple locking suture. Okay, I'll just show it to you. I'll cut this so that you're able to visible. You can see what I'm doing because there's very less station what I can show it to you. I'll remove all these sutures. So now we'll be doing something which is called as a simple running locking suture. Okay, so imagine this is my end. I'm clipping it, and we'll keep the scalpel at the other end so that you come to know this is our wound. And now we are trying to take it simple running locking suture. Initial concept is the same. We take a simple interrupted suture and park our knot here. short end, long end, 1 throw, 2 throws, catch hold your short end and bring it in opposite direction. Lock your suture by taking a surgeon's knot, and for extra precaution, a third one. Okay. Now we are not cutting. This is my long end. If everyone can appreciate, this is my long end. We are not cutting this off. Okay, because it's a running suture. But previously what we did was a simple running suture. Now we are going to do something called as a running locking suture. So again, we'll catch hold this 5 mm from the previous wound, previous knot, equidistant at both the sides, and my needle is coming out. And now, while my needle is coming out, this is my loop, right? Everyone can see this, right? This is my loop. I'm going to place the loop over the needle, and my needle is coming through the loop so that my suture gets locked. You can see this. I'll show a few more throws to you so that it is very much visible. Again, I'm going in equidistance from the previous bite. And now while coming out, I'm placing my loop over the needle, and my needle is coming through the loop so that it gets locked. When you pull it, it's a beautiful lace-like pattern which will develop on the skin. Take a few more throws with me, and then we'll lock this at the end. So again, going in at the same distance from the previous one, equidistance from each other. My needle is coming out through the loop, and just pull your long end or the needle end, and you'll see that your suture is getting locked on itself. So that is the reason it is called as a running locking type of suture. We'll go again. Same distance from the previous bite, equidistant at the both margins. Get the loop on your needle, pull your needle through the loop, and just pull your needle or tug your needle. You'll see that there's good, nice lace pattern which is developed. Last one, go in, equidistance from the previous one at the same ends, and now pull your needle. Every one of you has reached till this stage. Guys, if every one of you has reached this stage, then I'll show you how to lock this with an Aberdeen knot.
So just give us a minute, sir.
Yes. Take your time. Take your time. Reach till this stage where you're at the end of your incision. Do not put a knot to it. We'll do the knot in a different way this time. All of you have done it?
Yes, sir.
Yes, sir.
All of you guys have reached the end,
sir.
right?
Yes, sir.
Okay,
Yes,
so
sir.
now we are going to lock it in a different fashion. So what you do is, this is my free end of the needle. This is my loop. So all of you guys keep your loop like this. between your index, your middle, and your ring fingers in a triangular fashion. Yeah. And then you try to pull your, this is my free end or the needle end. This is my loop. See guys, have some patience. This is a different and difficult type of a knot, but it is a very nice knot which I'm trying to show it to you. I'll repeat it as many as times you want. So have some patience while doing it. Okay. So once again, this is my loop in my right hand, and this is the loop. Hold it in a triangular fashion. This is my needle end. Let the needle be away from you and just hold the end. And what you're trying to do is, through this loop, try to bring this free end towards you and just pull it, pull it, pull it, pull it, pull it, pull it, pull it. Do it again. Pull it, pull it, pull it. You will see that it is not getting locked. That is fine. That is okay. This will get locked at the end of it. So again, make a loop out of your right hand. This is my free hand. Pull the free end towards you and just bring it close. And once you have done 3 throws in this, last throw, you just pull the needle out and you'll see that this time this thing is getting locked. And you just need to cut one end. There are no 2 ends. So this is called as an Aberdeen type of knot. There's only one end and your suture is well locked in it. Take your time, go slow. Your loop won't get locked on first 2 throws. The third and the fourth will lock your suture.
So can you show the suture again, please?
The Aberdeen knot, you want me to show it to you, right?
Can you show it from the start, the suture?
You want me to show the entire running suture?
Yeah.
Okay. If you have not got Aberdeen knot in this time, it is okay. We are going to repeat that at least 2 more times when we go to next subcuticular closure. So don't worry, but I just wanted you to expose to this Aberdeen knot once. That's why I've done it now. Okay. So I'll just cut the suture of mine and take a simple running locking suture for you again. So for the one who wanted me to repeat the locking type of suture, I'll do it for you. So suppose this is the proximal end of my wound and this is the distal end of my wound. Initial principle is the same of simple interrupted sutures. Come out. One throw, 2 throw. Bring it to the opposite direction. It's not locked yet. So once again, pull it to the opposite end. And this is a secured surgeon's knot. Now we are doing a running locking type of suture. We are not cutting this needle end. Go back in again. Equidistant from the previous bite and pull your needle from the other end. While you are doing so and pulling, make sure you put your loop on the needle and your needle comes out through the loop. So your suture will get locked. It will look loose to you, but as you take multiple throws ahead, the suture will get tightened and it will get locked. We'll take few more. Equidistance from each other, equidistant from the previous bite. Pull your loop on your needle. Take your needle through the loop and just tug it. It'll get tightened on its own. Equidistant from the previous bite, equidistance from each other. Pull your loop on the needle, take your needle out through the loop and just give a good tug. You'll see that this is locked now. Just previously, I have shown you how to do an Aberdeen knot. This time we'll just do a simple knot on this. We'll go ahead with the Aberdeen knot in the next coming subcuticular closure. Okay. So now this time I'll close this. I'll put a knot to this. Go back again through the loop. But this time, do not try to pull the entire loop on the skin. Put your needle holder in the loop. Keep the loop a bit more so that you can put a knot to it. So now the concept remains same. One throw, two throws, catch hold the loop and just tighten it. Make sure that you are tugging both the limbs of the loop, 1 and 2. Reverse counterclockwise, pull the loop on opposite direction and nice locking suture. You have placed a good knot and a secure surgeon's knot. Every one of you is okay with this. Yeah? Is everyone okay with it? They're doing it. What's the status, guys?
Doing it, sir.
Doing it. Yeah, take your time. Take your time. If you have doubts, if you're getting stuck anywhere, share your screen. Let me know. I'll repeat it for you.
Sir, could you show how do you tie the last knot?
You want me to show you how to tie the last knot?
Yeah.
I'll do it. Okay. So this is, we'll keep it short this time. So this is my one end of the incision. This is my other end. I'll just put 2 throws and I'll show you how to lock it. So first is simple interrupted suture. You start with that. It's a basic one. Come out. And yeah, I did not tell you guys what to do if you have, suppose for example, you have this long suture in your hand. Everyone can see this, right? It is a long, very long. So to juggle around with this long type of suture is very difficult. So what you do is, for example, I've taken 2 bites and my needle, this is my needle. Everyone can see this, right? And this is the longest suture which I have in my hand. And it's very difficult to juggle around and take sutures with this. So what you do is you put your needle aside and you try to take rounds of the suture in your arm so that it is easy for you to maneuver. You see, I've taken all the suture in my hands. So 2 things, you are easily able to juggle with the rest of the small suture and your suture does not touch anywhere here and there so that it becomes unsterile. Put the entire loop in your hand. See this? Nice and good. Loop it in your hand completely. You'll be wearing gloves, of course, while you're suturing. So it won't get unsterile. Put the entire suture in your loop like this. And then take 1, 2. So this is the initial of my suture. Now, since this is a simple running type of suture, I'm not taking a knot anywhere here. Okay, we'll just put a running suture. We'll go back again. I'll take few throws for me to explain it to you who had a doubt of how to lock this. So we'll go back again. And this is my needle. This is my longish loop. I'll get my needle through the loop. And while I'm pulling the suture, see what I'm doing. I'm trying to loop around the entire suture around my hand so that my field becomes a bit clean. See this? It's a very longish suture, but the entire suture is in my hand. And the needle I've placed carefully so that I don't get puncture in my hand. Okay, so pull it, pull. And now the third bite which we'll take, we'll just put a knot to it. Again, go back, equidistance. This is my needle. This is my longish loop. Try to bring the needle from this end. Catch hold the needle in a fashion that it lies in your palm, but it does not puncture you. And while you are pulling, make sure that you pull the entire suture around your hand. Yeah. Nice and good. You see this? But now since we want to lock this, so don't pull your complete suture. Have a loop in your needle holder. This is my other end. This is the loop which I've created. Now I want to lock the suture. So one throw, two throws, catch hold the loop which we have made. And just pull it nice and hard. Make sure that when you're pulling, you pull both the limbs of the loop, one limb and second limb. When you pull the other limb, you'll see that your knot will sit nice, comfortable, good. Again, reverse, catch hold your loop and just pull it on the opposite direction. Make sure you pull both the limbs, one limb, second limb, and your knot is secure. Complete it with the third one. Am I clear to the one who had it out? Is it all okay and clear to every one of you guys?
Yes, sir.
So we have finished with almost all the common ones. We started with simple interrupted. We did a simple buried one. We did a vertical mattress. We did a horizontal mattress. We did a half buried suture. Pardon me. We did a, what was then? Simple running suture. We did a locking suture. Every one of you guys is absolutely confident with this, all of these. My God, is there some money to say a yes for you guys? Does it cost some money?
Yes, sir.
Yes, sir. Yes, sir.
All the girls are sleeping, yeah? Shivani, what's wrong?
Sir, I'm your only.
You are here, but none of the other. I can hear no female voices. Yeah, only guys are doing some things.
Sir, we're here.
Yeah, I can't hear you. You know.
Where are all the girls? Please don't underestimate. Like, don't disappoint us like that. The girl community. Where are you all? Give a loud yes shout out to sir. He's working so hard, continuously speaking for the last 2 hours.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Wow. Finally, some voice. Yeah, good. So we are coming at the almost end of it. We'll wrap this up with it is the instrument tie with something called as a subcuticular suture. Now the subcuticular suture is the most difficult one. It is the most cosmetic suture and it has a good learning curve. And there are a couple of ways in which you can do a subcuticular closure. So when I say subcuticular means there won't be any sutures on the skin whatsoever. All your sutures will go under the skin and it will be like a step ladder pattern or it will be like a S-shaped pattern under the skin running around. There won't be any sutures on the skin. There will be subcuticular. Cuticular means skin. So subdermal sutures will take. It has a learning curve, but it is the most cosmetic incision or most cosmetic suture what you can offer to your patients. And generally, I use this for faces, for forearms, and for visible areas of leg and in female patients where they don't want any suture to be visible. So we'll do it with the common way to do it. And then I'll tell you some variants in which it can be done. Subcuticular sutures can be done in like 3 most common ways. So we'll start with one and we'll slowly take it down. Now, I want to tell you that when you take a subcuticular suture, you take with a absorbable one, and you can take with a non-absorbable suture. The suture which is in my hand, which I had taken for demonstration, is a good proline. It's a 20 proline. It's a thick one. So we do not do subcuticular closure with proline. We do it with rapid vicryl, which gets absorbed in 14 days, or we use ethylone, which is of 30 or 40, very fine, so that the knot is not very visible on the skin, and it is a very fine thickness. So you'll see that this suture is a bit proud here and there, but that is only for demonstration. When you use rapid vicryl, which has a very thin needle and very thin suture material, or when you use ethylone 30, ethylone 40, which is polyamide nylon, you'll see that it beautifully sits in the skin. Okay, we'll start. So the concept is, you do not want every one of you guys be ready, do it with me. If you do it with me, you'll learn. So the concept is, there should not be anything visible on the skin. The first variant which we'll do is, this is my end. This is my end of one, and I'll just put a scissor on the edge. So this is my wound in which I want to do a subcuticular closure, where I don't want my sutures to be visible on the skin, and the scar should be nice. So what I'm going to do is, I'm going to go superficial, and everything is subcuticular, right? Your skin has no suture whatsoever. So you go superficial under your skin and you go deep. You do not come out through the opposite side. You come out through the wound. The needle comes out through the wound only. And right here, we are going to take a knot. We are not going to take a bite of the opposite end. We have just taken a superficial to deep bite of one end, and here only we are going to park our knot. Okay. So pull your suture, 1, 2, and 1, opposite. Yes. So we have taken a subcuticular knot at the start of our incision right here. Only on one end, we are not gone from the other end. Is this very clear to all of you guys?
So did the needle go through the skin or the...
No, we are not going through the skin at any circumstances at any point. It is subcuticular, meaning you're going superficial to deep, but you are going under the skin and not coming out of the skin.
Okay,
you can see that. I'll just zoom it for you guys, if that is okay. I'll just adjust my camera. Okay, so as you can see, this is my skin surface, and my knot is buried within the dermis. So it is a subcuticular knot which I've placed, and this knot is only at one of the ends. I'm not taken a bite of the opposite side. Is this fine with all of you guys?
Yes, sir.
Okay. So now we'll start doing our subcuticular closure. So the only important thing to remember in subcuticular closure is the bites which you're taking, it should be absolutely equidistant from each other for the skin to close. So this is my knot here. I'm going to take my second bite on the opposite skin, and it will be exactly opposite to my knot, and it will be horizontal. I'm not going to go like this. If it is visible, it's visible, right? Yeah, I'm going to go horizontal, and small bites, the bites of 5 mm, small bites. Pull your needle. Okay, Now my bite has come from here. So my opposite bite will be exactly in front of my previous one. For your closure to look absolute neat, clean, this is where my needle is come out. My second bite would be bang on opposite to this. That this is only one thing to remember. If you don't see it, this is one way I do it, that I pull my needle on the opposite side and then mark it. Okay, fine. This is where I'm supposed to come out second time. So what you can do is you can mark like this. You can pull the needle. Okay, this is the place where I'm supposed to go in, small bites, very small bites, come out, and it should be horizontal. It's like a step ladder pattern. You see, my suture is not at all visible from the skin. It is underneath the skin. That is why it is called as a subcuticular, right? Again, I'll pull my thread on the opposite side, mark that I'm supposed to come from this side, and go horizontal. Go horizontal. Pull it.
Sir, so it is like a subcuticular running future.
Yes, it is a running subcuticular closure. Yes, absolutely correct. Your knot or the suture material should not be visible at all. It should be subcuticular. Take small throws, take small bites, not big ones. Take small bites. You see, it is not visible at all. So that is the beauty of this closure. It is a good, secured closure, but your sutures are not visible. There are no skin marks, and your wound heals very beautifully in this. Again, go subcuticular, take a small bite, come out, and just pull. I have had, there's a knot and I need to correct it, otherwise it will trouble us throughout. Generally, you won't have this longish sutures. I have kept this long suture so that I'm able to explain it to you guys. But generally, you won't have this long sutures when you are doing it. Okay, you see this? There is absolutely no suture visible whatsoever on my skin. And now we'll try to lock this one. So take one more throw and then we'll lock this. And we'll lock this with an Aberdeen knot. Is everyone with me on the same page? Has everyone reached this? Sorry, guys. Has everyone reached the stage where I am right now? Yes? Is that a yes?
So can you give us a minute?
Yeah, I can give you 2. Yes? Can we go ahead?
Yes, sir.
Yes,
Okay.
sir.
So now we want to put a knot to this. So this is the end of, I've just parked a mosquito here to demonstrate that this is the end of my suture. So I'll just take one last bite on the opposite side. I'll pull it. I'll just mark where I'm supposed to take a bite. I'll just take a small little bite here. Okay. And this is the end of my wound. I'll pull out my needle, and now we are going to do a Aberdeen knot again. So this is my loop. Everyone see this? You can see, right? Every one of you can see this nicely.
Yes, sir.
This is my loop.
Yes, sir.
And this is my other end. Okay. What I'm going to do is I'm going to try to catch my this end with the help of my other fingers through the loop. So see this loop, free end, loop, free end, and I'm going to pull this free end towards me. Pull it, pull it, pull it. So now it is gone in. It is not locked. It won't be secure. And again, I've created a loop again, right? Same. This is my loop. This is my free end. Pull my free end through the loop and pull it, pull it, pull it. Second. Do it with me. This is my loop. This is my free end. Pull my free end through the loop. Pull it, pull it. Now it will be a bit secure, but it won't be 100% secure. This is not a secure knot now. This is the last which will. So we have done 3 throws now. This is my loop. This is my free end. Now what you try to do is this time you completely pull your free end. Pull it, pull, 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 and lock it. Now this becomes a locked knot. You can see this is good, secure, locked knot which you have made. But as you can see, this knot is visible on the skin. So what we'll do is this thread is still attached to the needle. I have not cut the needle right now. So what I'm going to do is I'll place my needle holder on the needle. As you can see that my wound is closed now, but there is a knot which is visible. So what you do is you go through the edge of your wound, come on the normal skin. You see, this is a normal skin. I'm coming out to the normal skin. Pull your needle through the normal skin. Pull, pull, pull. And now you can see that that knot is buried well. Pull your needle and just cut very flush to the skin. You can see the needle, the knot is absolutely buried. It's gone in. Every one of you is able to appreciate what we did.
Yes, sir.
Yes, sir.
Are you able to reciprocate it on your tables, what you have just done?
So could you tell the last part again where you use the skin?
Where
you pass the needle through the skin.
Okay, so I have to just demonstrate the last part to you, right? I'll take 2 bites, and for example, we want to do a subcuticular closure with an Aberdeen knot on this small area. So my wound starts here, and let's say my wound ends here. Okay, I'll just show it to you again. Guys, you can do it with me once more with a small knot. So I'll go superficial, I'll go deep. I'll make a knot there. 1, 2. One. Last one. And I'm going to cut my short end very flush to the knot. And now we'll start with our subcuticular closure. I'm going to take a bite bang on parallel to the opposite side. And it'll be a horizontal bite, small bite, horizontal one. Pull it apart. You see, the knot is nicely gone deep within the tissue. Pull your thread so that you know where to take the opposite bite. Mark it. Take a small, nice horizontal bite. Come out. Pull your needle. Again, the same step. Catch hold your thread. Mark it on the opposite side. nice horizontal small bite. And subcuticular, you never come on the skin whatsoever. It does not come through the skin. Entire suture is within the dermis. You can see there's no suture visible to you. And since we have reached the end of our wound, I'll take one bite and we'll lock it with the Aberdeen knot again. So I'll mark it, take a small little bite on the skin, underneath the skin. And we'll do Aberdeen knot again. So when you're doing Aberdeen knot, make sure that this loop of yours is, these two limbs are not crossed. It should not be like this. You see, there is a crossing. This crossing of the loop should not happen when you're taking Aberdeen knot, or both the limbs should be free, absolutely free. And this is my free end. This is my loop. And we'll try to take a Aberdeen knot again. So loop, free end. I'm trying to pull this free end through the loop. Pull it, 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 let it go in, and again make a loop. This is second loop. Okay, mark you, this knot won't look like it is locked now. It will get locked. Don't worry. Just tug this thread and make sure that you tug these two ends. So we have got a loop again. We have got a thread again. We are going to pull the thread through the loop. Pull, 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 pull. Now you'll get some secure fixation. It is not yet secure knot. So we have done 2 throws. We will do 1 more throw. This is my loop. This is my thread. I'm pulling my thread through the loop. Pull, pull, pull. And now you see that this is much better than the last time. Pull your threads. We have done 3 throws. Now the 4th throw, you are completely going to release this free end, needle end, completely. So loop, free end, pull it and just completely pull it through the loop. Pull, and you see this time it looks a very, very secure type of knot. But mind you, there is a knot visible to us, and this is subcuticular closure, which we do not want to see any of the knots. So what we are trying to do is now we'll bury this knot. To bury this knot, imagine this is the end of my wound. This is a normal skin. This is a normal skin, normal skin. So what I'll try to do is through the edge of my wound, I'll go in with my needle holder, come out through the normal skin. This is where the needle is coming out here, where my thumb is there. It is a normal skin from where your needle is coming out. So you pull your needle out through the normal skin, pull it, pull it, pull it, so that your entire suture goes well in it. You see that knot which was very much evident, now it's gone within the dermis. Pull your needle and just cut very flush to the skin. It's gone. Absolutely okay with this?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Good.
Yes, sir.
Yes, sir.
Lovely. So now these subcuticular closures, when you do, make sure that you have closed your deeper tissues very well. So what I usually do is whenever I am planning to do a subcuticular closure, you have to plan your closure very well when you're doing a subcuticular closure. So you will close your fascia, you'll close your subcutaneous fat very nicely with a buried suture. And when you're on the skin, and when you're planning a subcuticular closure, your skin should be absolutely tension free. See, what do I mean by tension free? I cannot do a subcuticular closure on a skin like this. If you can see, suppose this is my wound. I cannot do a subcuticular closure on the skin which is in tension or where there is gaping. My skin should be absolutely tension free and relaxed, and it should already be approximated like this. Then and then only I can plan a subcuticular closure. For my skin to be absolutely tension free and relaxed, I need to close the deeper layers very nicely. So you need to always think in your head before starting to close that in this thing, if I plan a subcuticular closure, I want to close my deeper layers very nicely, tightly, without any tension, so that my skin is absolutely approximated, and then I can just put a subcuticular closure and come it off. come off it. Is this clear? Your skin has to, this is a principle which you need to remember, that when you're planning a subcuticular closure, your skin should be absolutely tension free. It should already be approximated, because this suture is not trying to approximate your skin. This suture, type of suture, is just trying to hold whatever is approximated. Is this very clear in everyone's head?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Good. So what I have shown you right now is a subcuticular closure with a knot. We have made a knot at the start. We have made a knot at the end. Now, subcuticular closures can also be done without knots. So we'll try to demonstrate you what is a subcuticular closure without any knots. Okay. So I'll just remove whatever suture I've taken so that I'm able to show it to you, because the camera is in nice position. I don't want to move that. So let us assume my mother is going to kill me because I've spoiled her towel like anything. I've screwed it up big time. So this is the start of our wound. Let's assume this is a start. And let us say that this, where my scissors are there, this is the end. So everyone can see that this is our wound, right? It's very much visible to every one of you. I want you to really learn this knotless type of subcuticular closure. It's very beautiful technique. So what we do is, this is the start of my wound. This is the end of my wound. Okay. And this time what we are planning to do is a knotless subcuticular closure. So my needle will go in through the normal skin. You remember, this is the start of the wound. So this skin is normal. I'm going to take entry of my needle through the normal skin, absolutely normal skin, which is just proximal to the wound. I'll take entry. See, because I placed a needle holder, I'm finding it difficult to entry, but I'll just come out. And you try to come out at the edge of your wound. So my needle, this should come out through the edge of the wound. Okay. I've taken entry through the normal skin and I've come out through the edge of my wound. And now you'll start your subcuticular closure. There won't be any knot in this whatsoever, no knots. So you'll pull it and just keep the needle there. Don't pull your short end completely. This is my short end, which has gone through the normal skin. I'm not going to pull this completely. It stays there. And now you'll start your subcuticular closure. No knots, just start your subcuticular closure. Small running sutures. Keep your short end away. Small running sutures. Horizontal, small, nice running sutures. I'm sorry, guys. There's a knot which has come here. So you see, if there's a knot, I need to cut it. I'll show it to you again. Yeah. So this is the edge of my wound. Everyone can see. I'm trying to take an entry from the normal skin and trying to come out through the edge of my wound. You see, this is the edge of the wound and my needle is bang on come through the edge of my wound. So I'm pulling it. Do not try to completely pull it. This is a short end. It will remain here. Okay. And now I'll start with my subcuticular closure. make sure that when you're pulling your needle, the short end does not get pulled. It has to stay where it is. There should not be any tension on the wound. There should not be any pulling force. Just small bites, good small bites. Take it. And make sure you just tighten your small and long ends so that your wound is nice and approximate. Nice, small, horizontal bites. And your small end should be just proud of the skin, normal skin. Nice horizontal bites. So now let us say that this is the end of my wound. Yeah. This is the start of my wound. This is the end of my wound. My bite has already come out from one of the ends. So what I'm going to do now is I'm going to take a bite just opposite to the thread. And I'll come out through the normal skin. Just like we did previously on the proximal end where we went in through the normal end, here I will come out through the normal end. I'll just come out through the normal end and I'll just cut it. So you have a proximal end, you have a distal end, you have not placed any knots, and you have a good subcuticular. You see, I'm trying to pull it by both hands, but it won't open up. So proximal end, no knots, distal end, no knots. And on this, what you can do is you can place some steri-strips. So steri-strips are nothing like, they are better version of micropore. So what you can do is whenever you don't want any knots on your skin and you want a subcuticular closure, you insert your needle from the normal end, you take out from the normal end, do a subcuticular closure in between, and then to reinforce this, you put steri-strips on this and dress it. So this will be a knotless subcuticular closure. Is every one of you okay with this?
Yes, sir.
Yes, sir.
Yes, sir.
Every one of you.
Yes, sir.
And when you want to do a suture removal for this, you just have to pull, just have to simply pull this, it'll come out. Just have to pull your suture, nothing else, no knots, just have to pull it. Is everyone successful in doing this knotless subcuticular closure?
Yes, sir.
Everyone, right?
Yes, sir.
Sir, sorry to interrupt you, but it's already 12:30 and we have a panel discussion also at 2 o'clock.
2 o'clock.
So,
Okay.
Yes, yes.
Shivani, I understand. I've finished with the instrument tie. What I need to show them is just, I'll take 10 more minutes if that's okay with you.
Yes, sir. No worries. No problem.
Okay. Okay. If everyone is not slept, I would want to show you how to tie your knots with the help of hands. So it is called as a hand tie. Whatever knots we have done till now, those are instrument ties. And there's something called as a hand tie, which a surgeon should always know how to tie with your hands. So if the house is up for it, I can continue with it, or you want me to show it some other time?
No, sir. Continue.
Continue. Is everyone okay with it?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Okay. So we have finished almost all types of knots which should be in your armamentarium when you are doing knotting. We started with simple interrupted, simple buried, vertical mattress, horizontal mattress, half buried. We went on to do Aberdeen knot, simple running, simple locking, and last was subcuticular closure. Everything is covered. Most common things are covered very well for you guys. And also we have touched upon how to close a V-shaped wound if you have one. So I guess this covers 90% of your skin closures and your deep closures. There will be few things here and there, but that is not very possible for me to show it on a workstation. I need to do a practical workshop with you guys to demonstrate that. And we'll end this session by something called as a hand tie. Is everyone having a lace in their hands, or you want like a couple of seconds to arrange?
So can you give us a minute?
Yeah, that's fine.
Yes, sir.
So everyone, you can see my, just let me adjust. Yeah, my screen is visible well enough, or you want me to adjust? My hands are visible to you, right?
Yes, sir.
Okay. So every one of you can see that I have 2 threads in my hand. Okay. I'm a right-handed person. So this is my left hand and this is my right hand. Okay. This is my short end, which is in my non-dominant hand. And this is my long end, which is in my dominant hand. Okay. So non-dominant hand, small end. Dominant hand, the longish end. This is my long, this is my short. Is it clear till now? You see, guys, this hand tie is a bit difficult. You need to really practice it like every single day, and then you'll get it. It requires a lot of coordination. It'll come slowly. Do not get irritated. Do not get disheartened. It'll come with time. You just need to know the steps and it'll come to you. So we'll start with something called as a one hand tie. So what I'm trying to do is, this is my left hand, which is non-dominant. This is my short end. So what you do is thumb and your ring finger. You try to hold these two, the short end in your thumb and in your ring finger. Okay, this is the first step. Your index and your middle finger will be under your short end, and you'll be holding the end of your short end with the help of thumb and ring finger. Is this visible? And are you doing this?
Yes, sir.
Do it with me. Otherwise, you'll just get lost. So what I'm doing is thumb and ring finger. I'm holding the end of short end. My index and my ring finger are on underneath the loop. And now with the long end, you try to loop. You try to make a loop. Okay. Is this okay with everyone? Loop under my index and middle finger. Again, I'm holding short end.
Yes, sir.
I'm holding short end with the thumb and ring finger. My index and my middle finger are under the short end. I am putting a loop under my index and middle finger. And now what you can do is your middle finger will do all this. You see my middle finger? My middle finger will take the knot, go under this, and come out. Got it? It'll take time, guys. Do not get irritated and do not get disheartened. I'll show it to you again. Catch hold your short end with the help of thumb and ring finger, index and middle finger underneath. This is my long end. You make a loop and your middle finger, you see where my middle finger is going. My middle finger is pulling my long end, going over my short end and coming out again. So when you're doing hand tie, middle finger is a boss. You do all the magic with your middle finger. We'll do it again. Short end, I'm holding it with thumb and ring finger. My index and middle finger are underneath it. This is my long end. I'm putting a loop around my middle finger. My middle finger is my boss. He takes the long end, goes over the short end, and makes it come out. And you see nice, good looking knot which you can see. Has everyone achieved this?
Yes, sir.
So please show it again once.
Yes. I wanted that somebody should say, I want it. Again, thumb and ring finger. I'm holding my end. At all the times, you're not going to leave this end. Whatever happens, make sure you don't leave this. Okay? Thumb and ring finger, holding my end. My index and middle finger are underneath my short. This is my long end. I'm going to loop over my middle finger. My middle finger is a boss. So boss is always right. My middle finger takes the long end, goes over the short end, and just comes out. Is this okay?
Sir, by then can we leave the little side?
Yes. So when you are doing a loop, at that time you're supposed to leave from your thumb and ring finger. Only at that time. Till that time you're not going to leave. You're going to give tension. And when you're maneuvering it, at that time you'll just leave it. Look at it again. This time I'm not going to say anything. You just see. Okay. I need a volunteer. Who will volunteer with me? Come on, someone say yes.
Yes, sir.
I would prefer a girl saying that. Come on. Otherwise, I'll randomly pick up names if you're not. So, Sushma. Sushma is there?
Yes, sir.
Okay, Sushma, you're supposed to tell me what am I supposed to do. Tell me.
Yeah, 1 second. So you hold the ring finger and the thumb of your left hand. Yeah,
Okay.
and you put your middle finger and the ring finger under it.
Okay.
So, and you put the thread under your ring and middle finger. Yeah, you
Okay.
make a loop. Using the middle finger, you pull the left thread and then you remove your finger.
Beautiful. Wow, you taught me, Sushma. Lovely. Thank you.
Thank you, sir.
Is everyone okay with this now?
Yes, sir.
Yes, sir. Yes, sir.
Everyone can do it.
So to tie it, we have to put the thread
Yeah, so
around
see,
something, right?
To tie, you're just supposed to pull both ends and your knot will go. It is a sliding knot. So your knot will go and sit tightly.
So we're supposed to put that thread around something, right?
Yeah. So I've not shown you that. I assume that. Oh my God. You're asking me difficult questions now, you know. So you see this, I've anchored it here. So my knot will go and just imagine this as the skin. So my knot will go there and just sit tightly. Okay.
Yes, sir.
Is every one of you okay with this? We'll do it one last time and then I'll just show it to you how to do it other way around. This is the underneath. we'll do one over. So same as Sushma has told me that I'm supposed to catch hold between my thumb and ring finger. I'm supposed to put my index and middle finger underneath. I'm supposed to put a loop, and my middle finger is the boss that will bring the loop, go over my short end and pull. And you see this is a sliding knot. So when you pull it, your knot will just slide and sit on the skin. Okay. I hope and I wish every one of you has been able to do this. So now this is a underthrow. You also should know what is an overthrow when you are doing hand tie knots. So this first time what we did is we tried to catch hold in a thumb and in ring finger. So this time what we are going to do is we are catching it in the thumb and index finger. You see this thumb and index finger. And my short end is already looping around my rest of fingers. Is everyone able to see this?
Yes, sir.
I'm holding the short end in my thumb and index finger. My short end is already looping around my other fingers. I'm just supposed to place my long end. And again, middle finger is a boss. It goes in and got it?
So could you repeat?
Yes, absolutely. So this time, what I'm trying to do is I'm going to hold the end with my index and thumb, and my other fingers will make a loop. My longish end will just come and sit on my fingers. My middle finger will do the magic. It will take the loop, go around my short end and tie a knot. Any one of you wants me to repeat it? Come on, some answers.
So please repeat it.
Okay. I'm holding the suture short end with the help of end with the thumb and index finger. My rest of the fingers are underneath it and already made a loop. I'm holding it nice and tight. My long end is coming and sitting over my fingers. My middle finger will take the long end, go underneath it, go above my short end, and come out through the loop. Is this okay?
Yes, sir.
Okay,
Yes,
now
sir.
I'm going to randomly pick one of you guys to tell me what to do. So who will tell me? Is there a volunteer?
Yes, sir.
Who's that?
Sir, Aditya.
Aditya, come on, tell me what to do.
Sir, first hold the loop, hold the thread between your index finger and thumb.
Okay.
And then pass the loop below other three fingers.
Okay.
And then place the thread again. Loop it again over the other three fingers.
Which
like
thread?
From top.
Which thread?
The left one. The right one.
Long one.
Yeah, the long one.
Yes. Okay, I've done that now.
And then pass the middle finger over the right thread, the long thread, and under the short thread, and pull it.
Beautiful. Thank you, Aditya. Lovely.
Thank you, sir.
Now, Radhika. Radhika is there? Radhika? Okay. Rupa. They're not saying anything on purpose because I can see that they're here. Parul. My God.
Sir.
Parul, who's there? Parul?
Yes, sir.
Switch on your video. Let us see how you're doing it.
Okay. Yes, sir. Yes, sir.
Not sure if you can see. So I'll wait 1 second. I have to keep it somewhere for you to be able to see. So
okay.
I'll do it and I'll show you how I did it, or do I do it while?
Do it. Just speak and do it.
Okay.
What are you doing? Underthrow or overthrow?
So the one we learned right now was overthrow. Right?
So we'll do the overthrow. Okay.
So we keep the shorter thread on our left hand above all the fingers, and then the longer one goes towards the other side. And after that, we take our middle finger over the long thread and under the short thread, and then pull it towards the other side.
Good. Okay. You did it on yourself? Did you do it?
Yes, sir. I'll just take it on the camera. So this is
nice. Peter is there. Peter Samuel. Chaitanya is there. My God. So they've just logged in and went somewhere, yeah? Dhanush? What's wrong, guys? No one is ready to volunteer. Tanulina?
Someone.
Who's that?
Volunteer.
Sorry? Vivek? My God. Nobody wants to come forward, huh? Asmita?
So I can volunteer.
Who's
guys?
Who's there? Who's the
Aditya.
brave guy, brave surgeon who's volunteered?
Aditya.
Aditya, come on. Show us how to do the underthrow, and we'll wrap this up.
Okay, so just a minute. Let me turn on my camera.
Okay.
Is it visible?
Yeah, we can see you.
Okay, I'm doing it on my specs cover because I don't have anything good.
Perfect. Good enough.
Just a minute, sir. I hope you can see it.
Yeah, we can see it.
All right. So I passed the thread first. I between my thumb and my index finger, I held it.
Okay.
And I passed it between the three fingers.
Aditya, give a good tension. You see this? Give a good tug.
Okay, so it's not very.
Okay, got it. Fine. Fair enough.
Kind of
okay.
Loose. Then I took the thread from top and I passed it like that.
Yes.
I hope it's visible.
Yes, it's visible.
And then I took my middle finger. I passed it under this thread.
Yes.
That's the right one, and over the left one, and then I just pulled it like that.
Beautiful. Very happy. Wow. Very, very beautiful and nice. Good.
Thank you, sir.
Good. Okay, guys. Then this is it. I guess I have tried to touch all what is possible for me to show it to you on this towel and with the hand tie. I wanted to show how do you do it with two hands, but that would be too much to take because I want you to imbibe this one hand technique. Try to do it on your laces. Try to do it on whatever material you get. Practice it like for next 15 days. Be thorough with it. Your hand movement should be like at the spinal level, that your middle finger should start working as soon as you get like 2 threads. It should start doing this. It should just start tying. That is something which I expect from you. We'll do a 2-hand knot when we physically meet. My plan is to show the rest of the sutures, which advanced sutures which I've planned, and the 2-hand tie when we meet physically during the workshop. And we'll have something like a suture pad or a fake skin to work on well. So,
Sir, Clinicase is planning one offline workshop soon.
Perfect.
In few months. So definitely we will be keeping this offline workshop, and we will love to have you on board and physically teach students this suture skills workshop.
Perfect. So if anyone has any doubts, they can just ping me on LinkedIn or ping me on my email or Insta. I'll try to revert back as soon as it is possible. And I hope whatever we did today, you learned something and you'll just carry it forwards. And I'll be more than happy to see all of you guys in physical. So wish you all good luck. We are running short of time. I won't be able to take any questions for now, but anything, get back to me and I will reply in due course of time. Yeah, it is fun having you and lovely audience. Guys were amazing. Females, I don't know what happened. They slept or I have no idea. Maybe next time when we meet, they'll be more active.
Yes, sir. Thank you so much for giving such an insightful workshop and helping us throughout. I'm pretty sure the delegates really enjoyed. It went a little long, but it's okay. We have the upcoming panel discussion at 2 o'clock and the professional scope of surgery in India. We've invited 8 surgeons from all across India. So please do join for that panel discussion. And then we have another panel discussion, professional scope of surgery in abroad at 5 o'clock. We'll be having 5 surgeons from all across the world. So please definitely join in for these panel discussions. The day has just started for ICON-SURGERY 2021. So see you soon. And let's end this meeting.
Yeah,
yes,
last
sir.
thing, all of you guys send us the photograph of whatever sutures you have taken, nice, good photograph to the group which you are, and we'll just pick up a beautifully done winner. Yeah.
Yes, sir, definitely. Thank you so
Okay.
much, everyone. We will be ending this meeting now.
I'm
Thank
calling
you.
it a day. Bye-bye. Take care. Bye.
Bye-bye.
Thank you, sir.
Thank you. Thank you, every one of you. Thank you.
Thank you, sir.